Hello, I'm Dr. Maurie Markman from City of Hope, and I'm like to very briefly discuss an interesting paper, an interesting analysis. Um, it was recently reported in the Oncologist, entitled "National Survey of Patient Perspectives on Cost Discussions Among Recipients of Copay Assistance." We certainly know that the cost of cancer care is going up quickly. Certainly the cost of drugs, anti-cancer drugs, which are increasingly effective, those costs are skyrocketing. The question is, where do patients feel about these discussions of cost? In this particular survey, looking at 1,566 participants, this included patients who had cancer, but also a percentage, about a third, who also had autoimmune disease, who were also receiving, obviously, very expensive medications. But these are individuals who had copays. And the question was, how important are these discussions? And here's the response. 52% of the respondents wanted their doctors to consider out-of-pocket costs when deciding on the best treatment. And 61% of the respondents felt the doctors should ensure, I repeat, this was from the paper, ensure that patients can afford the treatments that are prescribed. Now, obviously, this is a very difficult issue. The doctors always want to do what's best for their patients. They have very little control, of course, on who pays for what, but clearly this appears to be a very strong statement by patients. They want the help, they want the advice, they want the guidance. Sometimes puts doctors in a very awkward position. They know what the best therapy is, they know the data, but they don't control who pays for what. But at the discussion level, this is what patients are asking. We want a discussion of the issues. And of course, they're also saying, please consider these costs when you make these recommendations. A very important analysis, a very important perspective, very complex issues, which clearly are not getting simpler with time. I thank you for your attention.